Assalamualaikum, Ultras Client Diagnostics. So this is the CBCT of the patient that you had requested. The area of interest are all the BDRs and endodontic treat for the endodontic treatment or for extraction and implants. We're starting with the 4-6, the 4-5, the 4-4, 4-5, 4-6, and 4-7. This is the transaxial view, which is basically the proximal view. Here you will be very clearly able to see the lower right 4-5, the lower right 4 is basically endodontically treated and seems to be doing okay. The lower right 5 has a cavity which is encroaching the pulp, which will definitely need endodontic treatment right here. Moving to the lower right 6, this is the mesial root of the lower right 6. The mesial root looks okay. Aggressive endodontic treatment, but no voids or any problems can be observed. Moving to the lower right 6 distal root. The distal root has a very radio opaque core, could be a nail core. You don't see any major radiolucencies associated with the lower right 6. The lower right 7, this is the mesial root of the lower right 7. Again, you can see we don't see any major periapical radiolucency, but we do feel like there's a crack situation here, which might just need extraction. Moving to the lower right 7 distal root, the distal root seems okay, but again we see a crack situation here developing from here, which is extending all the way to here, as you can very clearly see on this segment. So this lower right 7 definitely shows signs of cracks, so might need an extraction, but will need clinical correlation. Now moving to the upper right second premolar, the upper right second premolar is right here. This is a BDR, definitely needs an extraction. Our estimated the ridge length is 10 millimeters of ridge width with 11 millimeters of ridge height. We've got a periapical radiolucency, minimal bone, so hence immediate implant cannot be done. We will need a delayed implant treatment. This is the upper right 4. The upper right 4 has two roots, two canals. We do see a radiolucency associated with it. Moving to the upper right 3, endodontic treatment absolutely looks perfect, so nothing to be done on the upper right 3. Now moving to the upper left 3, this is the upper left canine. The upper left canine has a BDR, as you can very clearly see. You've got a good ridge here, definitely post extraction immediate implant can be placed. 9 millimeters of width with 15 millimeters of height. Upper right 4, again BDRs are present for two roots. Will need an extraction. We will have 9 millimeters of width with 11 millimeters of height. Moving to the lower right, lower left, my apologies, lower left first premolar. Again, absolutely wonderful ridge width. We've got a BDR with a periapical radiolucency. We've got 8.8 millimeters of width with approximately 16 millimeters of height. So immediate can be placed in this region as well. Lower left 5, again BDR with a lingual defect. So we will have approximately 10 millimeters of width with 12 millimeters of height. So we've got that. This is the lower left BDR of the 6. So again we've got 11 millimeters of ridge width with approximately 13 millimeters of ridge height. We do have a very deep lingual fossa, so something that our doctor needs to be aware of. The implant will have to be positioned accordingly. So this is all the areas where we can see. If you have any further questions, please feel free to reach to our team. We would be extremely happy to help. Thank you very much.